Hello from San Francisco. Good morning, good afternoon, good evening, wherever you are in the world. And on behalf of the team here at the Global Brain Health Institute at the University of California, San Francisco, we wanted to wish you a very warm welcome to today's applicant webinar for the Atlantic Fellows for Equity and Brain Health program at the University of California, San Francisco. My name is Niall Kavanagh, and I am the Communications Officer at GBHI at UCSF, and I'm very pleased to be your host for the next hour. We are very delighted to welcome close to 400 registrants from 70 countries around the world. Thank you for joining us today. Today's session is designed to introduce you to the Atlantic Fellows for Equity and Brain Health program at UCSF. We are a global community of emerging leaders working to advance brain health equity around the world. And in today's session, we hope that you'll gain an understanding of our program, as well as a couple authentic perspectives from Atlantic Fellows who will join us. And we also hope that you develop a deeper understanding of the application process and feel inspired and informed and hopefully confident to apply if you determine that it is potentially a good fit for you. So over the course of the next 55 minutes or so, we will first hear from the site director of the Atlantic Fellows program at UCSF. He will give an overview of the program as well as what we're looking for in our applicants. Followed by that, we will hear from two Atlantic Fellows who have kindly agreed to join us to share reflections on their participation in the program. And then we will hear from our Assistant Director for Program and Strategy, who will share insights into the application process, application and selection process. And then finally, we will close with a live question and answer session that will include all of our panelists. The session is being recorded, and the recording will be shared with all registrants following the session. Though we do encourage you, if you do have any questions for our speakers, to please enter it into the Q&A feature that you will find on our toolbar. Many questions will likely be answered in our speakers' remarks, but those that are not, we will try to answer during our Q&A. So with that said, and our expectations for the next hour set, I wanted to invite our first speaker to join us. He is the founding site director of the Atlantic Fellows for Equity and Brain Health program at UCSF. And he will share again more about the program, what we're looking for in our fellows, and more about our community. So I'd like to offer a very warm welcome to Victor Valcour. Victor, will you join us, please?
Sorry about that. I will try again. Can y'all hear me okay? I'm guessing yes.
Yeah, you're coming through loud and clear.
Okay,
Thank you.
great. Well, I'm delighted to be here. I have too many slides, as you'll learn is typical of me, but I'm going to try to go through some of the things that I think are quite important to know about joining our program. Um, so the first thing is that if you're applying to our program, you're really applying to the foundation year, which is here far to the left. It's 12 months, 3 to 12 months of that you are at UCSF. The rest you are in your home community. You get a lot of one-on-one mentorship, clinical experience, a lot of training on grant paper writing, a lot of community engagement, including the arts. But this foundational year is a stepping stone to becoming a member of the Atlantic Fellow community worldwide. Currently, we have 337 Atlantic Fellows for Equity and Brain Health in 70 countries. This includes a community that will be training at the same time in Dublin. And after that, you will also join this global community of 8 different Atlantic Fellows programs addressing things from health equity, race equity, inequality, economic inequality. So it's really a stepping stone into this huge community addressing equity, anticipating over thousands of people working on this around the world. I'm really speaking today mostly about these things, the foundational year and how we will accompany you in your alumni time. This is the distribution of our fellowship. A lot of people in Africa and Latin America by choice. Now, your year will look something like this. It's a 12-month program. You'll be online 2 hours a week taking classes. You will have intensives that will be in locations outside of the US, around the world, three of them, the first one occurring in September. They last about a week. They're very intensive. Your whole class will be together and you'll bond. You also will have time at UCSF, depending on visa requirement and other requirements, somewhere between 3 and 12 months. You'll have to rationalize how many months you would like with us, but also we're very aware of visa restrictions that are occurring. So as I already said, it's a 12-month program, 2 hours of virtual coursework every week. Depending on how much you understand the content, it may take you 2 to 3 hours to prepare because there's reading ahead of time. You can do this on your own. It's asynchronous. You have the three intensives that we cover all costs for. They're in three locations, allowing you to have contextual learning in different locations around the world. And then, as I said, between 3 to 12 months, tailored to your training, a stipend is provided, so there's no cost to you. You have access to our pilot grant application for $25,000 that's competitively reviewed, and you receive a certificate from the graduate division here at UCSF. Now, you know what we are in that, but you really don't understand who we are. And I want to go through that a little bit in these fundamental components, which I think are the most important thing of the training. First of all, value-based leadership. You will receive a leadership approach that's based on the Marshall Gantz approach of social change. It's taught by Kai Kennedy, who was faculty with us. Much of this is done in our first intensive. This year will be in Ghana. The year that you come may well be there as well, but it could be in a different location. It's a self-reflective leadership approach, not the typical leadership approach around methodology, but more reflecting on how you engage with other people. We focus on our values, which are authenticity, fairness, openness, respect, courage, and empathy. And our faculty tries to walk the walk to demonstrate the value-based leadership. I put this first because I think it's one of the most critical pieces of what we do. The clinical lived experience is another critical piece for us. It's important for us that you see a diagnosis of dementia being given to somebody if you haven't done that before. If you're a clinician, it's important for us that you learn differential diagnosis of dementia. So you get exposed to our research clinics as a clinician, and you will see every type of dementia, sometimes multiple types. Many people who come through our fellowship see more types of dementia than typical neurologists in the United States. But for those that are not clinicians, those that are perhaps in the arts or in, reporters or other aspects, it's also important you see the clinical lived experience. And we have opportunities to do that within our clinic where you can shadow doctors, but also we have a robust community engagement where you connect with people who are living with dementia, their caregivers, and diverse communities. I think it's just an amazing ecosystem on which to learn during your foundational year. There is the contextual learning and didactics. I've talked to you about it. They cover various topics that you can see here on the right, including things like health policy, which you wouldn't necessarily have expected. As I said before, this is 2 hours of synchronous learning. You will be with your entire class, video on, learning, but you'll have to consume the information ahead of time. It's on a Canvas virtual platform. You can read it at your leisure. You can go in as deep as you want or as superficial as you want, depending on what your interest. There are lots of links within this. So for those of you who really want to know a lot of detail, you can dig into a lot of details about all of them. However, those that want more of a superficial look at things can. Remember, this is not a mastery program. It's a leadership training program. You take from it what you can, what's useful. And then the intensive weeks are done in three non-US locations around the world this year: Ghana, Mexico, and South America, including the SILAT Symposium that will be sponsored by the Alzheimer's Association in our last one. A lot of this is led by our alumni as we begin to bring them in to lead in this process. I put in a little video here that I'm going to share with you because it tells you a little bit of what it feels like
it's
to
kind
be
of
in
like we
this
have
space.
three different themes here: Ghana and healthcare in Ghana. There's the stroke unit, and then there's me. I'm wondering how we're going to get get all three All three are linked, but how do we tell a story and go from one to the other? That's your expertise.
I don't know if it's my expertise.
When I was doing my different rotations, neurology just came naturally. I like things that are challenging because everybody said neurology was hard. So I was like, okay, let's do that then. This road is a bit bumpy.
I'm going to move on to the next slide. I just wanted to give you a sense of what it felt like to be in the space because we go into these communities. And if we go to Ghana, David will be one of your trainers. He'll show you what it was like to develop the first stroke clinic in West Africa. So you get a tremendous amount of contextual learning in these different locations, a lot of it driven by our alumni. The one on mentoring is something we're particularly proud of. There are over 300 faculty in the Department of Neurology here at UCSF, and we've chosen 16 to be the mentors for the 16 fellows coming in. So as a fellow coming in, you will have a unique mentor. Only you will be the only mentee of that mentor, which is really incredible. We meet with the fellows sometimes as much as weekly, sometimes every other week. You will develop your own learning plan. We call an independent development plan or the map for the year. And then your mentor will work with you to go through all the things you want to accomplish in that year. Bruce Miller, my boss, who leads the Memory and Aging Center, and myself are also meta mentors. So for each one of you, you will have meetings with us as well. Finally, links to UCSF and the broader community. UCSF is a health science campus. It's quite robust. There are programs in global health, in geriatrics, in psychiatry, nursing across the campus that you can engage in. There are a lot of research opportunities here, including research around risk reduction, research around interventions, the new medications that we have, research that are observational clinics of healthy people, people with mild cognitive impairment, people with language dominant disorders. All of these are open to you. You'll rotate through them, but also the entire campus is open to you to learn from. There's an outstanding community outreach program that I'm really proud of called Creative Minds. It's led by Sergio Lanata, one of our neurologists from Peru. And it is in the community teaching brain health to the community, lectures. A lot of our fellows either give lectures, sometimes in Spanish, your own language, because we have various communities across San Francisco, but also art-based interventions for people. And it's very much enjoyed by our fellows. It's one of the really special things that we have here at UCSF, where you're out in the community and really learning about the learned experience of dementia. And then the last thing I'll talk to you about is accompaniment. And this is really important. It's not necessarily in the year that you're with us, but it's your career. I use the word accompaniment. It's a word from Paul Farmer. He said to accompany someone is to go somewhere with him or her, to break bread together, to be present on a journey with a beginning and an end. This is how we perceive your fellowship. It's a lifelong support, as long as we're around to support the work you're doing. And our job is not to do anything, but to support you to accomplish what you want to do. There are lots of ways that this is done. You can apply for pilot awards with the Alzheimer's Association and the Alzheimer's Society. These are $25,000 to do something in your community. If you've never had an award before, this is an important milestone. You can accomplish your work, and we are side by side with you, helping you to understand how to do the budgets, how to enroll people, or how to do the arts-based interventions. We have fellows in, as I said, 70 countries. We bring them in when we have to make sure you succeed with your pilot, which is a huge stepping stone. But these pilots actually go on to raise lots of money and lots of activities, and we work with you to write grants, to write papers, to try to keep this moving forward. You can see from this slide that we've raised almost $160 million with our fellows in the alumni space. We're very engaged in this. We have a team that works with the alumni. And in fact, I would say we have about as much staff working with alumni as we do working in the foundational year. Examples of this, a large network called Red Lat in Latin America. $20 million. Most of the funds for the first 5 years were raised by faculty, although the program was run by an Atlantic Fellow entirely. Another example, Unraveled, a play that's going across the United States. We've raised almost $1 million for this play by one of our fellows, Jake Broder. We're also very engaged with the Conservatory of Music. We have a podcast that's elevating voices of our alumni as we speak. So there's lots of accompaniment as well in the arts. And we are doing a lot of work in capacity building, particularly across Latin America, where we're finding cognitive tests don't exist in many places. Lots of screening tools exist, but a harmonized multi-domain cognitive testing battery doesn't exist. So you can see from this green areas that we are investing to try to develop these batteries so that people can provide better care, but also do research. So we're very proud of the accompaniment, and I wanted to make sure that I shared that with you. And I'm happy to take any questions. Thanks so much.
Thank you so much, Victor, for the wonderful overview of the program. Next, we are going to invite to the stage to join us two Atlantic Fellows who have kindly agreed to join us to share their perspectives and reflections on the program. So Natalia and Rodney, I'll offer a brief introduction for both of you, and we'll also offer the profiles in the chat, so you can feel free to read more about Natalia and Rodney's work as well. But first, we have Natalia Pozo Castro, MD. She is a neurologist based in Santiago, Chile, where she works in dementia care and is helping to develop multidisciplinary approaches to support people living with dementia and their families. She is a member of the 2023 cohort of Atlantic Fellows for Equity and Brain Health at UCSF. You're very welcome, Natalia. And before we get a question to you, let's also introduce and welcome Rodney. Kiggundu Rodney Erismas, BFA, is a visual artist and a cultural practitioner from Uganda who uses art and storytelling to promote brain health, well-being, and dementia awareness in his community. He's also one of my personal favorite artists and a member of the 2024 cohort of Atlantic Fellows for Equity and Brain Health at UCSF. Natalia and Rodney, so wonderful to see you. Thank you for joining us today. I think wonderful that we have the opportunity to share with our audience directly from you what your reflections and perspectives of what it's like to be a fellow in this program. So Natalia, perhaps we'll start with you. As we just heard, you are a neurologist working in a public hospital in Chile. Can you tell us a little bit about what drew you to the fellowship and what you were hoping to gain from participation in the experience?
Yes, thank you very much for inviting me to this webinar. Thank you, Niall, for the presentation. I would say that as a neurologist working in Chile's public healthcare sector, at the time I was seeing patients every day who faced massive barriers to care. I applied to GBHI because I wanted to scale up my impact. I was really impressed by the Memory and Aging Center at UCSF, and I wanted to learn directly from their model. At the moment, I was trying to build a multidisciplinary team and a dementia center at my hospital, and I was really excited for the possibility to establish a similar dementia center at my hospital. And I was also very excited with the possibility of learning how to translate research into actual improvements, and that could actually translate to better access to diagnosis and treatment for the patients, and to be able to improve their quality of life and also for their caregivers. And while I was at UCSF, I was really inspired by how clinical care and research feed into each other. I realized clinical encounters inform research questions, and that the research findings have the potential to improve clinical care. So I realized that to really help my population in Chile, I needed to learn how to bridge these two worlds, that it's not something I was used to see or even consider before in the way I do now. GBHI offered that exact opportunity to learn how to apply, for example, for international research funds, and then with that can also be very helpful for applying to national funds. And I wanted to learn how to be able to obtain resources to validate diagnostic methods on Chilean population and contributing to the opportunity for patients to eventually benefit from this. And my experience at UCSF was completely eye-opening. Being able to observe and receive mentoring from world experts at UCSF who were really very welcoming and really open to teach us profoundly deepened my skills and completely broadened my vision. It gave me concrete tools and confidence to implement research initiatives and better care strategies to my population.
Thank you, Natalia. Wonderful. Well, we'll pivot now to Rodney. And similar question for you, Rodney, though coming from
Yes.
a different background. So you came to the fellowship as a visual artist and a cultural practitioner in Uganda. Can you tell us a little bit about what drew you to the fellowship and how you saw the arts connecting to brain health?
For me, thank you very much, Niall, and Natalia and Victor for sharing. Greetings, everyone. And my experience was, I could say, is quite different from Natalia. I had a lived experience with my grandmother, and I think that's my first intervention with dementia as a word. And through that, I got interest in learning more about what dementia is, what brain health is, and how to use my creativity as an artist to share the invisible stories out there in my communities, but also across the world using my creativity. So coming to GBHI and UCSF, to be exact, was for me an eye-opener because it was a place where I got to see the merging of clinical care, research, and creativity in one place, something that is unlike in many spaces that I had been into. So it was an experience that was quite interesting for me to learn from, meeting different experts from different countries and learning from them and collaborating with them and seeing how we can come up with solutions to the brain health challenges across the world. In my experience at UCSF, I managed to collaborate with many fellows, some of them in my cohort, some of them in the previous cohorts. Some of them were current fellows, some of them were past fellows doing their pilot projects. I did a project with Elijah Rock, who is a musician from another cohort, an album cover that I created with him on his album that he created to create more awareness around Alzheimer's and dementia. So for me, I saw UCSF also as a community or as a space where creativity was given a chance to thrive through for example, the community outreach program and the Creative Minds program, where we did a lot of community outreach and interfaced with firsthand with communities and adult centers, working with the communities and teaching them about brain health, but in a more friendly and more creative way. And also listening to their stories and assuring them that their stories are valid, I think for me was a very great experience. And I took that back to my home country currently where I am. And I'm doing my pilot. And most of the things that I learned from UCSF, especially the research, which I hadn't interfaced with before the fellowship. I'm now starting to see the valuable sessions that we had around research, but also the mentorship from my mentor. It so happened that my mentor happened to be the same mentor for Natalie. So seeing that the mentorship still goes on even after the fellowship shows the lifelong learning that the fellowship offers at UCSF. Yeah.
Yeah. Thank you, Rodney. Yeah, absolutely. The lifelong learning that we embrace. You shared a lot about your experience. I just wanted to tease out a couple of things. So I'll ask a follow-up question to you first, and then we'll go back to Natalia.
Yeah.
But when you first started talking, Rodney, you had mentioned that you have a very different story from Natalia.
Yeah.
Geographically, you come from a different space. Your professional discipline on the surface at least appears to be very different. And I know you and Natalia weren't in the same cohort, but you were in a cohort full of other fellows, perhaps who were very similar to you in some ways, but perhaps different in others. I'm curious if you can just share a little bit about what it was like to work alongside fellows from many different professional, geographical backgrounds. You're working with clinicians, researchers, other practitioners. How did you kind of navigate that, and how did you fit in?
The beauty about the fellowship is it pairs you with many interesting people. And one of the things that the UCSF gives you is an opportunity to hear how people are approaching brain health and dementia and Alzheimer's from a different lens. It could be from a clinical lens, it could be from a research lens, it could be from a lived experience lens, it could be from a journalistic lens. And for me, it was an opportunity to see how different the world is in terms of different approaches to brain health and how it is important to embrace the diversity in approach, but also the beauty in collaboration, in that if someone is coming from journalism, I'll refer to the video that Victor played minutes ago. The person who was shooting it is also an alumni. I think he didn't share that bit, but seeing how Michelle collaborates with David from Ghana, seeing that collaboration happen, I happen to collaborate with some fellows within my cohort as well to see how we can work together to come up with like a project around brain health. In one of the sessions, I remember working with Michelle, who is a journalist, who is a filmmaker, and Carolina, who is a physician, to come up with like a concept around how we can how we perceive brain health from a children's lens. This is something all of us hadn't experienced before, but it was something we learned from the fellowship, and that's the essence of collaboration. Even within sessions during the fellowship, that you will be paired with people who might not be coming from your professional background, but you need to come up with something that really um, uh, you get to present to the other fellows. And some of these have gone on to become projects worldwide that have even received funding. Yeah.
Yeah. Wonderful. Thank you, Rodney, for reflecting on your experience. And I wonder, Natalia, similar question for you. What was it like for you working alongside, working with such a diverse group of fellows? And I think you're on mute, Natalia. No problem.
Thank you. I was saying that I think this aspect of the fellowship is its most unique and rewarding aspect, because the fellowship has a really flexible program, and only a portion of the time is filled with fixed activities. So we have the freedom to curate our own professional development and focus on specific tools, but we have the opportunity of really interact with fellows from completely different parts of the world, and this is very enriching. Even when I was talking with fellows that share my same background, like they are neurologists, just because of the fact that they work in different realities and that we have different cultural challenges, that also enriched the discussion and allowed us to see different ways to face the same shared challenge that we had. And I think that traditional medicine often looks at dementia strictly through a biomedical lens, but for me, this experience proved that viewing brain health and dementia challenges from multidisciplinary perspectives is not just an advantage, it is really essential. Dementia is not only a medical issue, it's also a social, economical, and cultural challenge. And collaborating with fellows from really different and diverse backgrounds redefined how I view equity, and it taught me how to approach brain health from multiple angles. And I think this is what it is needed to create real and lasting changes at my country.
Yes, absolutely. And we need more of it. And that's what we're looking for in our future candidates for the program. Natalia, I wanted to follow up and ask you a question, and then we'll go back to Rodney. But you actually both mentioned mentorship as a significant influence or aspect or benefit of the program. I wonder if you can share a little bit more about your experience working with a mentor. What was that like? Did you feel supported? What types of support was offered? What was that like for you, Natalia?
Yes, it was a really rewarding experience. Right from the beginning, every fellow is paired with a dedicated mentor that guides you through the program and helps you even structure your goals at the beginning and throughout the fellowship. I think what makes this fellowship unique and so remarkable is that the faculty has such a big commitment to the fellows, and even that continues after the fellowship year is over. And it turns into a lifelong professional partnership. Even now, when I am working on new projects in Chile that are not directly tied to what I did during my year at UCSF, I can still reach out to the UCSF faculty for counseling, for guidance, and I think that is really, really important. On a personal note, my mentor support was transformative. While I was at UCSF, he allowed me to shadow him in his clinical practice and proactively introduced me to other clinicians at the Memory and Aging Center and to other researchers. And when it came time to design my pilot project, he really helped me, and his advocacy made all the difference. He connected me with specialized professionals across UCSF to make the project viable. Most incredibly, when we realized the project budget was a major barrier, he helped me very much and helped me to secure a massive discount on one of the kits I needed to go through with the project. And without his intervention, my pilot project simply would not have been possible. And this level of one-on-one practical mentorship is one of the most unique strengths of GBHI, I think. And it gave me confidence, it gave me technical resources. And as I said, I think this is something that continues after the fellowship. I actually talked to my mentor a few weeks ago on email, and he was really supportive again. And also the faculty in general, I think, is always really open to help, even if they're not your one-on-one mentor. So I think that's really unique and really, really helpful.
Thank you, Natalia. And Rodney, we'll go to you, and this will be our closing question. But similarly, and you had noted that coincidentally, you and Natalia happened to share a mentor. As we heard from Victor, there are many mentors in the program, but the two of you happen to share a mentor. What was that experience like for you, Rodney, working with a mentor?
Yeah, thank you, Niall. Similar to what Natalia said, I also happened to shadow with my mentor, and it was, for me as an artist, it was a way to get to see what clinical care looks like in UCSF and in a space where probably I had never been. So learning from him during the sessions that we had in clinic, but also getting out of clinic into the community outreach program where I got to see him do the brain health education was an eye-opener as well, but also a transformative experience, because this is something that I've carried on even in my home country, working with some of the experts here to see how they can extend care out of clinic. And it's something that I see that is something new to them, but also something that they find transformative, because it's not something that was done around here. So I think having him as a mentor, but also the faculty as a whole was a great experience to see that even as an artist, they get to support you in different capacities where they can, get to have you meet different people that you can meet in the communities out there, different artists in the communities that you can collaborate with in your project, but also as you develop your pilot, how to get to make it viable to the funder. So I think working with him was a great experience, and also the faculty at large. Yeah.
Wonderful. Thank you, Rodney. And thank you, Natalia, as well. We will ask you to hold any more thoughts. We will invite you back for the Q&A at the end. So we'll say thank you for now, and we'll invite you back to join back for a larger discussion soon. But we are very grateful for those rich and insightful fellow perspectives. Next, we would like to welcome our Assistant Director for Program and Strategy. She is going to be sharing more about the application process, timeline, tips for a strong application, etc. So I'd like to welcome Stacey Yamamoto. Stacey, you're very welcome. Thank you for joining us.
Thank you, Niall. I will be sharing a bit about our application process and tips to put together a strong application. So let's start a bit with the process. Listed here are the application components, including an online application form and 2 letters of support that are required, all to be submitted before the application deadline on November 2nd, 2026, so just under 3 months away. After applications are competitively reviewed, select applicants will be invited to interview in January of 2027. After these interviews have concluded, the selected applicants will be recommended for admissions, and notifications will go out about mid-February 2027. At which time an onboarding process will begin where official transcripts will be needed to be submitted to UCSF, as well as visa paperwork, etc., for the onboarding process to start the program in September of 2027. This website is where you can find all of the program details as well as instructions for the application and the application form itself. We won't have time to go into detail of all of the specific components, so please take the time to review this information very carefully. My colleague will put the direct link in the chat. So I'll share some tips for strengthening your applications. We receive a lot of questions about professional disciplines and backgrounds and eligibility criteria. And I want to share that we have applicants and fellows from all disciplines and professional backgrounds, as you could see from the fellow profiles who just shared their personal narratives. It's important to think about whether the timing is right for you in your career trajectory. So what I mean by that is competitive applicants have typically completed the highest degrees and associated training that they plan to pursue within their professional discipline. So for instance, physicians, we would anticipate that you have completed an MD or MBBS, residency, or other fellowship specialty that you plan to pursue. And you would need to demonstrate an interest in improving clinical practice in your application. Artists or other career professionals, creative professionals, excuse me, we're not looking for a specific type of advanced degree, but we would be looking at a portfolio of work and a public platform where you have showcased your work and have an interest in improving the lives of people living with dementia and their care partners. Researchers we would expect have completed a PhD and postdoc training. I'll note here that GBHI, the fellowship is not a postdoctoral, a traditional postdoc opportunity. So if that's what you were looking for, this is not that. But most people have already completed a postdoc if that's something that you plan to pursue. And other specialties, innovators, entrepreneurs, policymakers, public health professionals. We would really look for significant expertise in your field and a track record of achievement. Successful applicants demonstrate strong regional support in their statements of purpose and letters of support. So what do I mean by strong regional support? We want fellows to have support and guidance from mentors in the regions where you plan to have impact. So in the application, in the essay questions, which is the statement of purpose, you have an opportunity to describe who these local mentors or collaborators are and how they will support your work in your country. There will inevitably be challenges and roadblocks that you face, and these are the folks that will help champion your work and help you move things forward. The letters of support are an additional place to demonstrate this regional impact, or regional support, I should say. At least one should be from a current or past employer, institution, or organization, and the letter should show strong support for your career goals and path. So we're not looking for it to be signed by the most senior person at your institution. This really should be someone that knows you, knows your work, and will be there for you to help move your projects forward. A bit of logistical information about the letters of support. It's really important that you contact your letter writers early and confirm that they can submit the letter before the deadline of November 2nd. We have additional guidelines on our website. You will enter the letter writer's contact details when you complete your application, and then you will submit your application form. It is at that time point that your letter writers receive a link where they can upload their letter. And those letters must be received by the November 2nd deadline. So what that means is that you must submit your application in advance of that deadline in order to give your letter writers time to also submit the materials prior to November 2nd. You will get a confirmation letter when they submit, and it's your responsibility to follow up to make sure that your application is considered complete. In the application, you'll be asked to designate the amount of time that you plan to spend in San Francisco. And it's important that you think carefully about the duration of time that you would like to spend in San Francisco. There is no right answer to this question. We are not looking for one option or the other, but really we want you to designate a time that aligns with your professional goals, what you're hoping to achieve in the program. Employment possibilities. You are expected to participate in a full-time capacity when in San Francisco, so this would require employers to release you or give you a leave of some sort that you would need to arrange. So what's possible here might be a factor in your decision, as well as visa policy for a J-1 visa in your country. We are aware of various visa restrictions for J-1 visas, so please ensure that the time you designate aligns with visa policy, as well as personal circumstances. So this is the timeline, the program timeline that Victor shared. And just to clarify here, that 12 months at UCSF would mean being in San Francisco between September of 2027, the program start, through August of 2028. Typically, those that choose to spend time 3 months in San Francisco, we ask that you come between intensive 2 and 3, which helps with travel logistics and cuts down the back and forth of travel, but also allows the cohort to overlap for some time in San Francisco, provided that you all will learn from each other as much as you will from anyone of the faculty or instructors in our program. So of the program components that Victor shared, I want to differentiate a little bit about the ones that can occur internationally or virtually versus what happens in San Francisco, so that you can make an informed choice about how much time you'd like to spend here. So participating in leadership training, the contextual learning and didactics, both the weekly coursework and the international program intensives, one-to-one mentoring, and the accompaniment that happens after the program can all happen virtually and in international settings. Now, the components of the program that happen in San Francisco include the clinical and lived experience and links to UCSF and the broader community. So this is where you really want to think about your goals for the program. In both durations of time, you'll be able to observe research visits, case conferences, lab meetings, but those that spend 12 months will have a much more immersive experience, and those for lesser time will have fewer encounters. If you are a researcher and would like to collaborate with Memory and Aging Center faculty using data from the center, you really will need to spend 1 year at UCSF in order to do that. So alongside links to UCSF and the broader community, leading projects with the community outreach program would be if you're an artist spending a longer duration at UCSF, and if you're spending a shorter duration, the expectation would be to attend activities and observe, but you really wouldn't have time to lead your own independent project. Other factors to consider here. If you are an individual from a time zone where you would not be able to participate in the live sessions at UCSF, so 8 a.m. Pacific time weekly are when the class sessions would be. If that is in the middle of the night for you, it might be wise to suggest that you will spend 1 year in San Francisco if possible, as well as considering visa restrictions and employment. So here I've listed in closing some final selection criteria that we look for, but I want to take this as an opportunity to share that we're aware that you will do your best to put together a strong application. This is a competitive program, so we know all that comes with that, and the pressures of putting together a polished application might be such that you're tempted to use AI tools to help you with your application. I really want to stress here that it's really important that we hear your voice come through, and that your statements of purpose are really linked to your experience, your deep commitment, and your strong ties to your community, which really will come through in your own voice. So we are not looking for really polished and generic answers. We really want to hear your genuine responses here. So please share what you want to do and how you'll do it, and explain why all of this matters to you. So we really look forward to seeing your applications and meeting you in the interview process. So with that, thank you, and please reach out to GBHI, apply@ucsf.edu. We'll put it in the chat once more, but any specific questions that you have, we are happy to answer. Thank you.
Thank you so much, Stacey, for that wonderful overview of the application process and tips for a strong application. I see the Q&A has come alive, lots of questions and interest in this space, so thank you. I'd also like to welcome back all of our speakers. So Victor, Natalia, Rodney, if you wouldn't mind turning your cameras and microphones on, please. Welcome back. Lovely to see your beautiful faces. And we will now spend the next 10 minutes or so reviewing some questions that are coming in from our audience. So thank you all for your openness to participate in this section. One question that's come up, so UCSF is one of two sites that operates an Atlantic Fellows for Equity and Brain Health program. We also have a sister site at the Trinity College, Dublin in Ireland. Some in our audience may have participated in a webinar hosted by the team at Trinity last week. So a question came in about, and Victor, perhaps I can direct this to you, but how should someone decide whether the UCSF, whether the fellowship at UCSF or Trinity is a better fit for them?
Yes, well, thanks for the question. The selection is completely independent at the two sites. Recruitment and selection is 100% independent. So it's difficult for me to comment at all on the Trinity site. I would recommend that you read our website, not only the GBHI at UCSF, but the Memory and Aging Center. Take a look to see if you find yourself there. Think about the resources that exist at UCSF. Give some thought to the mentors you're likely to have at these two places. Really compare those things to decide what the best fit for you is. Also, and I recommend this to everyone anyways, have you talked to the fellows in your country? They are incredibly useful, or in your region. We have fellows in 70 countries. So perhaps there's some value in talking to some fellows from that went to each of the sites and ask what was it like? What did you get? What were your days like? How busy were you? How much support did you get? How many meetings did you have with your mentors? What were the meetings like? Investigate. I can't speak at all for their process. I can only speak about ours, and I tried to highlight in my talk some of the things I think are pretty valuable from the UCSF site. Yeah.
Wonderful. Thank you, Victor. And just to second your recommendation to connect with fellows in your home countries or regions, I have generally found the fellows to be very open, honest, authentic people. So I would second that recommendation. Thank you, Victor. All right. There's a few questions coming in related to stipend and cost of living. Stacey, I know you touched on this, but perhaps if there's anything that you'd like to elaborate on. But a few questions I'll kind of try to roll into one. Is there any stipend provided to the fellows during program for their work activities? Is there a tuition or other fees that need to be paid? And then if I may, Stacey, roll this question into it, but there is a question about, is it mandatory to visit UCSF for the short term? And if so, is there any financial support for travel?
Thank you for that question. Yes, so the program-related travel is covered by the program, both a round-trip ticket to San Francisco for participation in the time at UCSF, as well as the 3 international program intensives is covered. For the duration of time that you are in San Francisco, we provide a stipend to cover cost of living expenses and housing. And with regard to tuition, you are enrolled as a student in the UCSF Certificate in Equity and Brain Health program, and tuition is covered on your behalf as well.
If I could take a moment to point out something distinct in your question, Niall. We are not a non-residential program. We're a hybrid program. We find it critically important that you interact with us, that you see how we walk the walk, how we handle things in our unit, how we interact with each other, how we view a clinical experience, how we get into the community. We don't have the answers. We're not telling you how you should do it, but we want you to be able to see how we do it, how we lead with values. So we have intentionally chosen a hybrid approach to increase accessibility and to allow people with visa challenges, family challenges, work challenges, to have greater accessibility to our program. Yet it also remains important to us you spend some time with us. We really want to create fellows in that mold. So at least in the current form, we do not offer a non-residential component. We offer a hybrid component.
Wonderful. Thank you, Victor. Thank you, Stacey. We've got a couple of more minutes before we wrap. So let's see if we can get another question or two in. Perhaps this one for Rodney and Natalia. What tends to surprise fellows most once they begin the program? Were there any surprises in your experience, Rodney or Natalia?
Natalia, can I go first?
Please.
Yes, I think that is I think the answer would vary depending on the fellows because we are from such different backgrounds, so it tends to surprise differently. But I was really surprised by the facility and by the big opportunities to learn in clinics, and really, really surprised by the openness of the professors and the faculty to teach us and to support us. I think that was a really nice surprise I had. And I was also very surprised and about the diversity of the cohort and how well we could work all together and share our different points of view and to tackle challenges from these different points of view.
Yeah, thank you, Natalia. I think for me, it goes back to something that Victor stated earlier. You take from it what you can. I remember when I reached, there's this aspect of waiting to be told what to do, and yet you have to actually figure out what to do for yourself. I think Natalie also hinted on it. The aspect of molding the trajectory of your career the way you think best it works for you with the resources you've been given. And I think UCSF presents a numerous number of resources in terms of the mentorship, the value-based leadership, the access to community engagement. And sometimes you can get overwhelmed with so much that sometimes it can feel a bit, you can feel a bit stuck, but of course you have to take it a day at a time because it's intense but rewarding at the end of the day. So I would say that was the shocker, but it was rewarding.
Wonderful. Thank you, Rodney. Thank you, Natalia. All right. And before we move to close, let's see if we can get one last question in here. So I'll direct this to Victor and Stacey, and if I could ask for you to keep your comments brief, please. But what do you wish prospective applicants better understood about the fellowship before they apply?
Boy, I don't know. I guess one of the things I will say, because it's been on my mind, is that this is an entryway to a huge community. It's 16 people in your class, and then another 16 or 20 that are current training at Trinity at the same time. And then it's 337 Atlantic Fellows for Equity and Brain Health in 70 countries. And then it's, approaching 2,000 equity-based leaders around the world, linked by the Atlantic Institute at Rhodes House in Oxford. So this is an entryway into a large equity-based community trying to tackle huge issues. Stacey?
I think that's a great response, and just what the fellows covered, that you will learn from each other as much as you will from faculty and instructors of this program. And those collaborations will continue to sustain for years to come. There are many collaborations among fellows that we have no knowledge of because they're just organic connections and people doing incredible work around the world. So.
Yeah, I'll just comment, Stacey. If you're coming to be taught, that may not be your program. Because we don't know the solutions in 70 countries. If we pretend that we do know the solutions, you should tell us off, frankly, tell us to think about our own community. What we can do is create a community where you can learn, you can see how it's done in other places, you can talk to people, you can take what's important and apply it in your context, and we're there to support you to do it. This is not a program, a typical training program. It's a leadership-based community where you will be provided so much content, and it'll be up to you and your regional mentors to determine what's useful to advance our global joint vision around brain health.
Wonderful. Thank you, Victor. Thank you, Stacey. And thank you to all of our speakers. This brings to a close our Q&A section. So if I can invite you to exit, and we will wrap up our session. Okay. So appreciating that we covered a lot of ground today. You might still have questions. We weren't able to cover it all. As Stacey had noted, if you do have outstanding questions that are not covered in our session today, or perhaps on the website, please do feel free to reach out to the GBHI apply at ucsf.edu. And I also wanted to note upcoming application deadlines, November 2 for UCSF and our sister site at Trinity, applications will be closing on the 18th of September. And to learn more about, we heard a little bit from Rodney and Natalia today, but to hear more stories of the work and leadership journeys of Atlantic Fellows, please tune in to our new podcast, Brain Bridges. You can find it wherever podcasts are hosted. So please do tune in and give it a listen. And with that, I just wanted to thank our audience. Thank you for joining and for your attention today. And thank you, special thanks to Victor, Stacey, Natalia, and Rodney for sharing your insights and experiences. And also a special thank you to Kaylee Mateo and Caroline Priolo, two of our team members, for all of your help behind the scenes. We really hope that today's session has given you a helpful sense of our program and the community that you will be joining. So thank you again for spending the hour with us, and we look forward to reviewing your applications and welcoming some of you to the Atlantic Fellows community. Thank you and take care.